Hi, we're joined today by Dr. Nicole Riordan. She's medical director at the Memorial Emergency Care Center. Dr. Riordan, thanks a lot for joining us today.
Thank you.
So we are here to talk about monkeypox because it has been identified now in both Elkhart County and in St. Joseph County. So Dr. Riordan, what do we know? What don't we know at this point?
Well, it's a fluid situation right now. What we do know again is that there's been an identified case within our county, and with that, it brings a lot of awareness, I think, to the community and also to the emergency departments and primary care physicians. And so, right now, we're trying to sort out with the assistance of the health departments and CDC as far as how to go about treating patients and kind of how to proceed in our roles as emergency providers.
What can you tell us about monkeypox? What is it and how can it be transmitted?
So monkeypox is an orthopox virus. It's in the same family as something like chickenpox. And it is transmitted mainly through direct contact. And that's usually prolonged direct contact, such as intimacy, uh, kissing, potentially direct contact with lesions. And the virus, from what I understand, is very different from something like COVID, where we have to worry about respiratory transmission. The concern there with COVID is that you could be in a space with another person for a brief period of time, inhale particles of the virus, and contract COVID. We are not concerned about that from the standpoint of monkeypox, which is a really great thing from the standpoint of a community, that we don't have to worry about being outdoors with someone or in a restaurant, because that would not be prolonged direct contact. So what we need to know is that if someone has a rash that would be concerning for monkeypox, we definitely should not have direct contact with that patient or that person. The symptoms of monkeypox start off, unfortunately, with a viral prodrome, is what we call it, which is a very typical situation with many viruses, just even the common cold or influenza, with fevers, not feeling well, maybe some body aches. The typical portion of monkeypox, about 99% of cases, have this typical rash. And that rash can start in the mouth, can spread to the face and the extremities. And that rash starts kind of like a pimple, potentially becomes a little bit bigger, and then gets fluid within that pimple, which we call a vesicle. It can even become a pustule, which has a little bit of pus in it, and then it will open and scab over. Individuals will be contagious through the time of having the start of symptoms, through the rash, and until it scabs over and forms a new skin layer.
So how concerned do local residents need to be? I think what you're doing is sort of drawing a line between or explaining the differences between COVID and monkeypox, and they're different.
Mm-hmm. Yes, and I think right now we're cautiously optimistic that we'll be able to contain this virus and that we don't have to be as concerned as we were with COVID per se, with the transmissibility of that.
Yeah, so it's not requiring us to mask, to social distance. I mean, you don't want to come into contact, but what you're saying is it's a lot different from COVID.
Yes.
So the World Health Organization over the weekend did make it a public health emergency. What does that mean? Because that sounds very alarming from a consumer standpoint.
Sure. So, from what I understand, this would just mobilize international resources to contain the virus so it doesn't become a pandemic.
Okay, so symptoms and what you should do if you think you may have been exposed or that you might have it.
So, symptoms again, they're going to start like many viruses do, the fever, not feeling well, maybe body aches. The main hallmark of this disease would be the actual rash. And so, again, if you have a rash with fever, we need to be concerned for monkeypox, especially if you've had contact with someone who has monkeypox.
Okay, and guidance, I mean, what should you do if you believe again that you may have contracted it or might be showing symptoms? Because a lot of people might again be on kind of that alarm state and be wondering what they should do.
Sure. So if you've been exposed to someone who has monkeypox, or if you have symptoms that are concerning for monkeypox, you should call your health provider or the health department to get guidance. If you feel like you are ill enough that you need to be seen in one of our emergency departments, if you could let us know when you arrive so that we can properly care for you, that would be appreciated.
Dr. Riordan, thanks so much for your help today.
Thank you.